I was diagnosed purely by accident about 7 years ago.
Right.
I had a friend of mine, a cardiologist next door, said, your father had a heart problem, just come around and I do a whole bunch of tests. And then he diagnosed Kawasaki disease. We noticed the arteries are large. Admittedly, I had never had symptoms. Interestingly, I went through all my life without knowing it. My colleague assembled a whole team of cardiologists, cardiac surgeons to find what would be the best course of treatment. And they started me on warfarin. As soon as the fourth cardiologist said, well, there is no evidence, I opted out personally to go on aspirin. And about a year after that, a year and a half after that, I had a heart attack. When I was diagnosed, when I had a chest pain, less than 2 hours, I was in King's College Hospital in a cardiac lab, and it opened. And as soon as they opened up the artery, the pain went. So the damage to my muscles is minimal. Mm-hmm. And that's thanks to the system of cardiac network system that we have in UK. Quite interesting to go from become a doctor, dealing with a day-to-day activity and seeing patient. Suddenly you're on a receiving end of acute care. Mm-hmm. And you have very little control. I'm back on a warfarin, mm-hmm. Back on a whole bunch of tablets, and also added aspirin. So what they have really done now is a super duper anticoagulation. It's not difficult to take, and it has very little side effect. I now know that my disease is a serious disease. Mm-hmm. It can have a serious consequence, and I need to stick to the treatment I have. Mm-hmm. I'm just more interested about how the rest of those people who have not been lucky, like me, have a fulfilling life and not worry about it, how they go through life and how they are affected. The fact that there should be early diagnosis. I think that's quite an important. The prevention is always better in healthcare than actually treatment. Treatment never is as good. Mm-hmm. It's much more painful for the child, for the adult, for the family, and it's more expensive. As a society, we have to deal with the early diagnosis. Now, Kawasaki is one of the many other diseases, but the effect is long-term. Mm-hmm. And it's effect quite devastating if it's not recognized. If one can find a way to diagnose early and treat them, if one find a way that to improve the quality of life, we need to now think, what are the early things we can do to shift the balance? We have created over the last at least 10 years, a cardiac network in UK. This is amazing. And the fact that I can have a cardiac episode in any part of UK and end up as an adult in a cardiac lab and to be treated so fast is probably something that we have to be proud of it as a nation. Now, there should be marginal effort to extend that to children. Mm-hmm, mm-hmm. And it's a marginal effort to recognize this group which require a specific treatment and a specific extended skills to be introduced into the system. So when you said how I want a system, I want system recognize it and get it skilled up. Mm-hmm. And to be honest, this is doable. This is not a difficult thing to do. Mm-hmm. There is so much effort has gone by cardiologists, the pediatricians. We just need to bring it to a point that all of this evidence translate to better care. Yes. Otherwise, you have a whole bunch of evidence sitting on the shelves, If we cannot translate that to better care, every child, every adult who get a cardiac episode and not treated today, it's actually missed opportunity. That bit requires speed. We are good at getting system in place, but it takes too long. I'm absolutely sure if we can just build on what we have, we can translate that evidence to better care in a much shorter space of time. They should be able to, when they confront a patient with Kawasaki disease, how they give them a definite management plan of how to manage the disease, rather than ambiguity. There is no guideline. There is more and more guidelines. There's more and more understanding of it, to be much more actively involved in the management of the patients at that stage. And secondly, when the patients come as an acute episode, I expect now our cardiologists, building on the 30 years of knowledge and expertise, and manage this disease at marginal effort. So that last mile to accommodate Kawasaki disease should not be difficult for them to do. It really is not a hard thing for them to do. But if they have not got themselves trained or knowledgeable about this, it's a missed opportunity. It's a missed opportunity for the patient and for them. As a doctors, you want the best for your patient.